Hello, my name is Dr. Harpinder Shevchenko from Smiles by the Sea Family Dentistry, and we are going to be talking about dental crowns today. What are dental crowns? So dental crowns, consider them something, a shell made of different materials, and it almost actually acts like a helmet or like a jacket around the tooth. So it is a shell which is made of different materials, typically nowadays with tooth color materials. It's a little bit much stronger than porcelain material, and it actually covers the tooth entirely around 360 degrees. So just like a helmet on our head, and the crown goes in the tooth like that. So dental crowns work once they're placed on the tooth just like your natural tooth. Whether it's on your front tooth or on your back tooth, they're going to function like you had your tooth, normal tooth, like a natural tooth. And a dentist might recommend the dental crowns in different case scenarios, and one of them could be that if the tooth had a large cavity and the tooth is hollowed out, and if it's left like that, it will break. So the dental crown, as we talked before, will cover up the tooth and just holding it together, not letting it break. That could be one scenario. Other scenario could be that if you already have a fractured tooth, the part of the tooth broke off, whether it's half of the tooth or more than half of the tooth, and then dentists will recommend a crown so you could keep your tooth in your mouth. So dental crowns help you keep the tooth in the mouth in these kind of scenarios where there's still tooth structure, enough tooth structure is there. We can strengthen that and make sure we can keep your tooth in the mouth. Other scenario could be that if somebody had previously a crown on the tooth and that crown broke off, or patient got some cavity under there, we're going to remove the old crown and place a new crown on top of that. What are different kinds of dental crowns available, and when will dentists recommend you a certain kind of crown? So there are different kinds of dental crowns based on the materials, and also actually how the crown is made, how much surface it covers. Like a full crown will cover, as we talked before, like a whole 360 degrees. There's other kind which we call them 3/4 crown, which will cover 3 surfaces and a little bit of another surface towards the inside of the mouth, not the whole tooth entirely. And those are the different kinds of crowns, and based on the materials. Nowadays we use mostly tooth color crowns, and they are made of zirconia material, or we could have crowns which are made with metal underneath and there's a porcelain covering on top, so in your mouth it will look just like your natural tooth. Or not as much common nowadays, but other kind could be a gold crown. And now to the next question, that your dentist will recommend you what kind of crown is best in your scenario would be based on clinical findings, and they will take a look that where is that tooth which is needing the crown in your mouth. So based on that, they will recommend the material for that crown, and it could be more aesthetic area, so they're going to choose the crown which is going to look like very natural. It's going to look like just your natural tooth. The light is going to pass through. It's going to look very, very aesthetic, and of course it's going to be very functional and strong as well too. So the dentist will make the recommendation based on where the tooth where they're working on in the mouth is, how much of a tooth structure is still available to them, and how is the in general strength of the tooth which is remaining there, if the tooth has a root canal on it or not. So those are the different kind of scenarios that play a role in, and the dentist will decide what crown material and what kind of crown is the best in your situation. How long do dental crowns last, and what factors affect their longevity? So dental crowns can last as long as 30 years. I have seen patients who have had crowns done 30 years, 20 years, 25 years, 35 years. And the factors that affect the longevity, one of the main factors is that hygiene. If the tooth structure is kept clean, there's no cavity forming around the crown can last you, as I said, anywhere from 10 to 40 years. So the biggest factor that patients end up needing a new crown, or they end up losing the tooth, is development of the cavity around the crown, because cavity can still develop around where the crown is sitting on the tooth. So you want to make sure that the tooth is kept very clean, like the way you're cleaning other natural teeth, so there's no buildup of bacteria, what we call plaque there on the tooth. So that's one of the biggest factors. Other factors could be that if somebody is grinding heavily, they can break the crown. Other factor could be if somebody got gum disease, severe enough gum disease that their entire tooth has to come out. So those are some of the factors that play a role in the longevity of the crown. What to expect when you're getting a dental crown from starting to finish? So there are a few steps involved. The very first thing would be that your dentist will numb you, making sure that you're comfortable. And then the second step would be they will take a mold of the tooth where we're going to need a crown on the tooth. So that way we can make you a temporary crown before you go home, as the lab makes a permanent crown in most cases. Sometimes dentists can make their crowns in-house too, but generally I'm going to be explaining here if it's a process like where the crown is made by the lab. So first thing would be, again, the dentist will numb you, explain you all the risks and benefits and the importance of the crown, why you need the crown, how it's going to benefit you. And then they will do what we call as a temporary mold, take the color, what color we want to, because we can do beautiful colors now, we can match your adjacent teeth exactly. So we'll take the color for the tooth, and then the dentist will go into removing any decay, any cavity that's there, if there's in the tooth, or if there's any broken filling, remove the tooth, get it really nice and clean, and then we will fill it back in with a very strong base material, so that way that it's not an empty shell, it's strong from inside as well too. And then we will shape the tooth. And nowadays in my office, we are typically doing, once the tooth is shaped up for the crown, we will do scanning. It's a very cool machine, 3D scanning, no goopy impression taking for that, because we have to hold it for a long time. So we will do the scan, and scan goes to the lab, and the lab makes a permanent crown. And then we will fabricate your provisional crown, as we call a temporary crown. So you will have it for about 2 weeks in your mouth. We will put that temporary crown on, give you all the instructions to follow, and you will come back 2 weeks after to put the permanent crown on. So that is basically the procedure from start to finish for a dental crown. What are the benefits of dental crowns compared to some other treatments like fillings or dental bridges or something like that? So the benefit of dental crown is that dental crowns help you keep your teeth in your mouth. Like as we talked before, if the tooth is fractured, by doing a dental crown, you can still save your natural tooth. And there are so many benefits of saving a natural tooth. One of the biggest benefits is that it's your own tooth in your mouth. And you can feel when you're eating, you can enjoy the good foods. And also when the tooth is kept in the mouth, your bone also stays on. Because when the tooth comes out, your bone shrinks, it impacts the other neighboring teeth, they tilt in, and all that, like a cyclic roll starts happening. So we stop that process. If we are doing the crown, your tooth stays in your mouth, and your entire dentition is basically saved like that. So if you're getting a big filling, what happens is if the tooth is already weak and we are putting a very big filling, every material has an indication, for where they can be used, how successful they will be in that area. So if the tooth is very vulnerable, it's weak, it's already fractured, if we're putting a filling on, we are really not strengthening that tooth. We're not really holding up the tooth, like as we talked before, like a jacket. So it's not holding the tooth together. You're leaving the tooth at very big high risk of fracturing. So when we put a big filling on the tooth is already weak. As you use it for chewing, the tooth can break off. So that's why we recommend a dental crown in comparison to a big filling, to make sure that the tooth does not fracture. And at the same time also, a dental bridge will be needed if the tooth came out, is used as a replacement option. But in that replacement option, we're going to also be needing to cut down two surrounding teeth, which could be very healthy teeth. So saving a tooth by a crown, you can avoid taking the tooth out, you can avoid cutting other teeth. So that's the biggest benefit of a dental crown, to be able to help you save your natural tooth. Are there any disadvantages or risks of getting dental crowns? So depending on your case scenario, in most cases it's actually the opposite, it's advantageous and it's beneficial. That's why the crown is being recommended. But some of the disadvantages, which is kind of on the lower side, is that we are cutting the tooth structure. If your nerve is still alive, some patients might feel some sensitivity for a certain number of time. When they're going through the procedure, sometimes they can feel some achiness, or they can feel a little bit of a tension in their jaw because they were open for the procedure. As I said, the tooth could be sensitive for some time, and we are cutting the tooth structure. So that's kind of the disadvantage, that we are removing some of the tooth structure. So the risk with the dental crown is sort of a more kind of in alignment with the disadvantage. The risk is that you might have some sensitivity after on the tooth if the nerve is still alive in the tooth, and the tooth can end up needing a root canal. So that's the risk, that you might end up needing a root canal on the tooth. That's pretty much it. Some disadvantages and some risks kind of similar to each other. Why one might need a dental crown after a root canal? So when the root canal treatment is done, we are basically removing the nerve, and that nerve canal is filled with the root canal filling material, which is a special material which is used to fill that canal where the nerve actually was living before. And since we basically are cutting down the blood supply to the tooth, and the nerve is taken out as well too, the tooth stays in your mouth, but it becomes brittle over time. And also that leads to a very high risk of fracturing the tooth, because it's essentially a dry tooth in your mouth, and we are still using the tooth, it's still functioning, it's taking the load, but it's not as strong anymore as your natural live tooth. So that's why majority of the times the dental crown is recommended, so to hold it together. So almost as we talked about before, like putting a helmet or putting a jacket, so we can like holding it together so it doesn't break apart. So that's one of the main reasons why dental crown is recommended in majority of the cases after doing a root canal, to avoid the fracture of the tooth. How much do dental crowns cost, and what factors affect that cost? So dental crowns, depending on the cost, can vary depending on where the crown is in your mouth, front tooth, middle tooth, back tooth, and it will also vary based on what kind of material is being used. So the cost will be different based on that. And what factors will affect that is that, again, same factors. And also, if you have a dental insurance, if you have a benefit that your insurance provides you towards the crown, that may reduce your co-payment out of your pocket if insurance is helping you out some towards that cost. And nowadays there's a lot of financing available. Patients are very easily able to afford the crowns and be able to save their teeth, keep their teeth for the rest of their life by using, if they have any benefit from the dental insurance, or there's many financing options available, with interest, without interest, with very low payments. Many different options are available that patients are being helped these days to be able to keep their teeth. I hope I was able to answer some questions and give some light on what dental crowns are, how do they work, how much they cost, what materials and all that. And if you have still any more questions, or you have any other questions that you want to get answered, please feel free to call us. Our number is 603-926-8827. You can also visit our website and get some other information on it. Is www.smilesbythecnh.com, and we will be happy to help you answer any questions. And I also invite you for come on in for a consultation and talk to me, ask me questions. I'll be happy to help you saving your teeth.